This simple flowchart explains how a medical bill becomes a debt, from accessing care, to failing to pay the bill in a timely manner, to how that bill then goes into collections and becomes a debt. The complex nature of medical debt is associated with the fact that healthcare is only utilized when people need it, and circumstances that lead to the need for healthcare are often unpredictable. The unpredictability of seeking care implies that it is very difficult to plan in advance for most cases. After any form of interaction with the healthcare system, consumers receive bills from their insurance companies, doctors, or the respective healthcare facility. Half of healthcare consumers are to a certain extent unable to navigate healthcare systems on their own owing to various contracts between providers, insurers, and third parties, especially collectors. The opaque nature of the various contracts listed before, minimal transparency in pricing care service, the complicated nature of bills and healthcare problems, and lack of overall support especially from counselors imply that all the complexities of the healthcare system easily translate into burdens for the patient. At any given time, patients have to determine how accurate their bill is, make the necessary follow-ups in disputing the relevant charges and reducing those that could be reduced, get involved in payment plans, and explore the availability and eligibility of financial assistance. Patients have to do all these in an attempt to reducing the likelihood of debt going into collection. The imbalance of power, coupled with little to no transparency in healthcare systems, leaves patients at the mercy of their healthcare providers with few protections or opportunities for personal advocacy. An unpaid bill becomes overdue, then it impacts a household's credit and the related purchasing power, all of which could contribute to filing for bankruptcy. The rising cost of healthcare has been a massive problem for America and Americans, with the greater part being difficulty paying medical bills or the inability to do so. The medical debt problem is especially worse for the uninsured, who are the most vulnerable. The high cost of healthcare mostly manifests in financial burdens for those seeking it, and further creates significant challenges trying to seek quality care. The strong relationship between health and wealth informs the need for accurate presentation and understanding of the cycles involved in medical debt. The normal medical debt life cycle begins with bills incurred due to failures in the healthcare system, with the most common failure points being the actual cost of care, discounting care, and the coverage of care. As mentioned, the system requires the patient to know what they're eligible for, especially the charity care program that provides free or subsidized care for those who cannot afford it. Non-profit hospitals are required to provide charity care under the Affordable Care Act of 2010. However, half of non-profit healthcare organizations still charge patients who qualify for financial assistance. Some sources suggest that non-profit hospitals have charged patients who qualify for financial assistance up to $2.7 billion. Lack of transparency and price misinformation often worsen the impact of financial assistance or lack thereof in the decisions that healthcare consumers are forced to make. Misinformation includes the services covered by insurers, whether healthcare providers are in or out of network, and what the normal course of treatment would look like. These areas of misinformation often lead to patients incurring high out-of-pocket expenses, which is the first step in the medical debt life cycle. Besides decisions surrounding seeking healthcare and the related complexities, patients also experience difficulties when it comes to dealing with settling accrued medical bills, which brings back the whole issue of price transparency and how it pushes patients into medical debt. The three-part system that is the patient, the medical provider, and the insurer, is always left for the patient to make sense of for the most part. 2/3 of insured adults who have a medical debt have some sort of problem with their bills, the most popular problems being late bills, unclear statements, and higher than expected charges. 30 to 80% of medical bills have some error, the most common is an overcharge. Surprise out-of-network billing is common, and it occurs when an individual visits an in-network facility or provider and they end up being referred to an out-of-network provider, or some of the services required in the treatment process are outsourced to an out-of-network provider without the patient's knowledge. Surprise out-of-network visits result in surprise billing that is associated with higher costs since providers bill patients directly and at a higher rate. 1 in 5 insured adults experience an out-of-network billing after seeking care, with the rate of surprise billing being closely the same. The complexities associated with the medical billing process and concerns over how medical debt affects individuals' credit scores often leads to people paying bills that they are not required to, thereby making overcharging by medical providers easy. Over a third of healthcare consumers have paid bills they weren't sure they owed, with the bill being over $1,000 for a fifth of patients. The lack of pricing transparency and billing issues validate the need for laws, policies, and programs that focus on protecting consumers. Most complaints to the Consumer Financial Protection Bureau revolve around medical debt collection and the circumstances surrounding its existence. The No Surprises Act seeks to provide additional protections to patients receiving out-of-network treatment. The Act works by requiring patients to pay the in-network cost-sharing amounts of emergency services, or when they unknowingly receive non-emergency care from an out-of-network provider in an in-network facility. The Act forbids healthcare providers from billing patients directly, but instead, they are required to discuss with insurers to come up with a reasonable settling amount. The No Surprises Act, while it offers more protections to consumers, does not address the current issues surrounding a huge chunk of medical debt arising from surprise billing. Medical bills vary based on patient and provider characteristics. Uninsured and out-of-network patients often receive higher medical bills compared to what in-network insurers pay, despite that they have limited ability to pay, evidenced by the lack of medical insurance in the first place. These bills to the out-of-network and uninsured patients could sometimes exceed the primary provider's costs. For-profit investor-owned hospitals charge some of the highest markups for emergency care when the patient has limited negotiation capabilities. One in 5 patients' credit is affected because of medical bills and resultant debt going into collection. The problem with medical debt, which is actually one of the greatest sources of complexity, is the fact that consumers aren't making informed decisions to borrow money or get into debt. Underwriting is not involved when dealing with medical debt, which raises the risk of patients accruing unaffordable bills. The whole collection thing starts off nice and easy and then just goes off the rails as time goes by and the collection agencies are not getting their money, at least at the rate at which they want to. Fewer than half of healthcare facilities actually comply with consumer protection policies, especially the Patient Protection and Affordable Care Act requirement to inform patients when they're eligible for financial assistance or charity care. The kind of approach used by hospitals or medical providers in seeking reimbursement from patients is quite interesting to say the least. Basically, the providers or facilities attempt to collect the bill in-house or resolve to sell the debt to a third party, which then makes it harder for patients to negotiate anything or clear the bills of any errors. Even worse, collectors, whether actual collection agencies or medical providers, end up reporting the medical debt to credit bureaus, which adversely affects patients' future borrowing capacities, including the ability to borrow to settle the debt. The collections also litigate in public courts with the aim of pushing patients towards paying their debt, resulting in more court fees, levies, loss of income, or putting lien on properties after judgment. Any form of debt collection litigation often benefits the plaintiff more than the defendants, especially considering that between 70 and 94% of respondents don't respond to collection lawsuits filed by the related agencies or medical providers. The low response rate results in an equal number of default judgments at around 70% of collection suits filed. Default judgments make it difficult to dispute anything, including inaccuracies that were made during billing. 91% of defendants in collection cases and 95% of people with default judgments hanging over their heads are from moderate to low-income households, a phenomenon that makes it difficult to afford post-judgment negotiations. Some of the most common reasons as to why defendants rarely respond include outdated and poorly enforced rules that hinder the timely notification of defendants, the fact that courts can be confusing and intimidating, the inability to afford legal presentation as evidenced by the fact that less than 10% of defendants in medical debt collection suits had legal representation throughout the 2010s, and problems with logistics involved in cases.